Thank you again, everyone, for joining us this afternoon. My name is Sandy Swanson. I am an advisor and a member of the Potentia Wealth team here today, and we are excited that you have joined us. We have experts here who are going to be sharing their secrets and their tips for navigating healthcare and aging. And it's not eating more kale, and it's not solving brain puzzles. Just so we're clear. So we are going to have a conversation amongst the three of us that hopefully will provide some practical advice for you. And I just ask that you hold your questions to the end, and then we've allowed plenty of time for a question and answer session for you. And that said, I'm going to let our experts introduce themselves. And I'll just start with Julie Brzenovich.
Hi, I'm Julie Brzenovich, and my company is Senior Life Matters. I've been in the industry about 9 years, working with seniors to help, simplify and help you understand this maze we call Medicare.
My name is Carrie Landrum. I'm a geriatric consultant. I have a company called Next Steps for Seniors. I've been in the industry 30 years, actually a little over. I absolutely love what I do, and the main focus is guiding families on the next step for themselves or their loved one, typically more when healthcare needs arise. And so I kind of guide through that maze, which is very complicated sometimes.
Perfect. Well, thank you both for being here today. I appreciate it. So what I know is that there are more of us aging in this country than ever before. And I look at my life. I've got a granddaughter now, and my parents are still alive and pretty active. And that's thanks in part to the better healthcare system that we have. We are able to replace knees and hips and joints. But navigating our resources through that is becoming the real challenge. And what do we do when we've reached a point where we need more assistance and more help? What's my right as a child? What is the right of a caregiver in assisting with that? So hopefully we'll address some of those questions and more today. And I'll start with Julie. Mm-hmm. I've heard Medicare. Everybody talks about Medicare, and then I hear Medicaid. Can you tell us a little bit about Medicare versus Medicaid, what exactly all of that is?
Yeah, well, Medicare and Medicaid they're very different. They're both government programs. However, Medicare is for people who are age 65 and older, or under 65 with special certain chronic conditions. And Medicaid is for people with lower income. So one of the things that I do is I work with both. So there are many clients that I have that are just with Medicare. And then there are clients who have lower income that might have Medicare and Medicaid, and we call that a Medi-Medi. That's what it's called, Medi-Medi. And we have dual special needs plans for people like that that are in that situation. And they are really fantastic plans that work together and coordinate Medicare and Medicaid at the same time. So the client gets a lot of extra rich benefits: dental, vision, hearing, transportation, all those kinds of things. So,
nice. And I always hear, and you mentioned age 65 as kind of that magical age. So what happens at age 65 that we need to do? What happens if we miss age 65 for some reason?
Great question. So at age 65, you are in your initial enrollment period prior to your 65th birthday, and that's when you can enroll into Medicare. Many people choose to continue to work at their employers as an employee and have a group insurance plan. And if you're doing that, then you are not required to sign up for Medicare, at least Medicare Part B. You're actually not required to sign up for A or B at that time, but most people choose to sign up for A because it is something you've already paid for through your working years, which is the inpatient hospital, skilled nursing, and hospice is Part A.
And that takes us down another little bit of a rabbit hole maybe, but there's Part A, there's Part B, there's supplement. What are the differences and what's the most important to start with?
Well, that's let's see if I can shorten this, because that's that's the meeting that I have with my clients. That's what we spend our 40 minutes on. So to shorten that, basically A is for, like I said, inpatient hospital, skilled nursing, and hospice. And Part B is for outpatient care, labs, MRIs, CAT scans, everything that is not A. Okay, so that's considered original Medicare, and that's basically your foundation. And once you get A and B, that's when I come into the picture and help, because there are many holes and gaps in original Medicare. And that's what we talk about, are those holes and gaps, and how we can fill those holes and gaps with a couple different options. One of them being maybe a Medicare supplement with a standalone drug plan, or another option is Medicare Advantage, which includes your drugs and many other ancillary benefits as well.
And then backtracking a little bit, I also heard you mention that people are working longer than before, so age 65 is not necessarily when I want to stop. My employer offers a health savings account, an HSA, which is a great thing to take advantage of. Am I impacting my HSA account around Medicare and those requirements?
That's a great question. I get asked that quite often. And the answer is that when you qualify for Medicare, when you sign up for Medicare, you may be qualified but choose not to sign up yet for it. But if you do get Medicare A and or B, then you are required to stop contributing to your HSA 6 months before you are enrolled. Otherwise, there's a penalty on your taxes. You're not going to have that tax-free advantage savings. So you can still use your HSA money that you've saved, you just can no longer contribute to that. And if you're married and you are not able to contribute to your HSA, that doesn't mean your spouse, if they are under 65, can't. You can still have your spouse contribute to the HSA.
And that brings up another good question is, if I've been fortunate and if I have not had to work and contribute to it, am I still able to take advantage of Medicare or Medicaid when I am 65?
That is a great question as well. Many people have worked 10 years or 40 quarters in the United States. And if they have, then their Part A, you've paid for it already. So you're not going to have a Part A premium. Everyone does have a Part B premium, though, unless, again, we talk about Medicaid. There could be times where you don't have to pay that Part B premium. But if you are coming from outside the United States and you have not had your 10 years or 40 equivalent quarters, then you will have to pay for your Medicare Part A, which can be up to $450 around there per month. So it's very expensive. However, if you are married to someone who has worked their 10 years or 40 quarters, then you can actually use their benefits and not have to pay for your Part A.
Thank you, Julie. I appreciate that.
Absolutely.
And then I know we'll circle back on some more Medicare, Medicaid thing, but I wanted to talk to Carrie as well, because the other big topic in the room is aging, and it's happening to all of us. And some of us are dealing with aging parents or relatives. And what does that look like versus, those of us who are the parents and we're having to make decisions and choices. We thought we would age in our house this whole time, and all of a sudden we can't navigate steps and stairs. So tell us a little bit about what your process is in helping, let's say, the parents themselves for now.
So, typically I get a phone call from somebody just with some basic questions about what is that next step. My first step in helping individuals with their next step is to do an assessment, because each situation is so unique. So planning ahead is always a great idea in many aspects of life. You can't always plan ahead for what your individual needs or your loved one's needs are going to be. They vary, but so I feel like utilizing a consultant can help you navigate that. Like, what's the first thing I should do? Because a lot of times people think like, oh, well, it's time to move into a nursing home, and I'm like, oh my goodness, no, like that you don't need to do that. So the first step really could be just, an assessment and then maybe having some in-home care, and Part B Medicare pays for some of that. So that was valuable information. And sometimes if you've been in the hospital, and they may recommend that you go to skilled nursing for rehab, but you could also go home and get rehab through Part B of your Medicare. So although, my focus is on the next step kind of with resources outside the home, I really work at trying to help people stay in their homes for as long as possible, utilizing the resources that are there, and sometimes they're just not familiar with them.
Right. And I think that's for me, I see an ad on YouTube, or I go to Google and just start Googling things, and that's how I get my information. So I'm sure there's a lot of good information and misinformation out there. What's a question or two that you ask folks to kind of help them make that decision to age in home or to move to an assisted living facility?
Well, if someone is considering a move outside the home, I try to figure out what needs are you trying to have taken care of outside the home that you can't have met inside the home. So let's focus on the home first, and then if the needs can't be met there. So one big aspect of trying to decide, should I stay home or my loved ones stay home or move elsewhere for their care, it's looking at not just the morning routine or the afternoon routine, evening and bedtime routine. It's really looking at 24 hours, because a lot of people they need help in the morning, or really they only need help on shower days because they can't navigate that, or just meals. And sometimes that's daunting because you don't know where to start, so you think oh, well, it's time for me to move out. But sometimes I try to sit down and really just look at a full day. What's your, go through that routine and kind of write everything down. And one family, they were so sure that mom needed to move out. And after I wrote everything down of what she did during the day and everything, I said, well, really it boils down to Thursdays. You need somebody here on Thursdays because it's garbage night. Your nephew comes here, the neighbor's over here every Tuesday. And so the mom was like, yes, that is what exactly is garbage night, because she fell once bringing the garbage cans in. So she was able to stay in her home another 3 years. And 3 years later, I would go out about once a year and meet with them again. And then about 3 years later, I did another, third assessment. And it's okay, now it's time, because now the needs grew. And lots of times, not to talk about a, taboo subject, but can you get to a restroom and back on your own? If you can't do that, staying home, that gets really challenging. So a lot of people don't really think about that. They think, well, I just need a little bit of help. And it's okay, but how many times a day do you need a little bit of help? And that's where home care doesn't always work unless you have somebody who's living in, because you can't predict when that need arises.
And I think that's one of the challenges for us, is we need to be able to have those conversations. And they are uncomfortable conversations. And so it's nice to have maybe somebody who's not so close to that person to step in and ask in a wonderful way. And I know I speak for experience because I'm going through that with my parents, my sister and I. And sometimes I'm not as tactful as I should be, and I'll be like, get up and go. So it's I can see the benefit of just having that person sit down and work not only with my parents, but then work with me. So what does that mean for my sister and I if we're having to make decisions for our parents? What is our role, would you say, in this?
So it's wonderful to have family support, and but ultimately, if cognitively the older adults are of sound mind, they are the ones making the decision. Just because somebody turns a certain age doesn't give a child or any other relative the right to I think it's time for mom or dad to move now. It's still their choice. So I do really talk to families a lot about autonomy, and that even though you may not agree with mom or dad's choice, if they understand the consequences of their choice rationally, then it's still their choice. But sometimes their choice may really not be a good one, and I see some other red flags. I've been successful at really just talking to families, with the individuals, to help them really get a feel for the whole day. Lots of times I do assessments also in skilled nursing facilities. So somebody was there for a rehab, hip replacement, or a stroke, or something, some event, medical event, and they're recovering. And they think like, oh, well, they say I'm ready for discharge now. Yes, but you're not quite able to do this, or you can't navigate the stairs, or you can't do that. So that's where I try to help them really look at all of their daily activities through that 24 hours. And what areas are you going to need? And will a 4-hour a day assistant from a home care agency be sufficient? Or do we really need somebody kind of checking in on you every 1 to 2 hours throughout the day? That's when moving out for like assisted living or hiring somebody full-time is what you need to focus on. But yeah, you don't really get to make the decision. It's kind of a family thing. Like with our kids, up until they're 18, we help make those decisions. It's our job. It's legally, we're responsible to do so. There isn't some magic age with our, as we age or as our parents or other family members age, where it's like, oh, gosh, mom just hit 85, so now I have to make decisions for her. Or that's not how it works.
Right. And I think that's one of the things we, as human beings, have a hard time with is losing our independence and having to go into an assisted care. But then there are others who have had the foresight, and I know we've talked about continuing care retirement communities, and they sound lovely, and you walk in, and it's like a resort, and they take care of you from day one. But you've mentioned to me some of the things to be mindful of if you're going to go that route. So can you talk about continuing care retirement community, CCRC?
So a CCRC is a model where you typically buy in to it early on when you're still independent and you live independently in a little cottage or apartment, and then you stay on the same property, and within that property they have another section for assisted living. So once maybe you're not able to independently walk to a dining room, or maybe your vision has declined and you can't read your medication, so you need assistance with that, then you transition to the assisted living. And then they also have a healthcare facility or skilled nursing facility on the premises. So then there are certain guidelines within assisted living. If you don't fit into that box, then they decide. The continuing care retirement community, the CCRC, makes those decisions for you. So for some people, it works out marvelously. It's some really nice, lovely places. And then on the flip side is you do lose a little bit of autonomy because they're making the choice for you. They have their own guidelines, their care models, and if you don't fit into that, like I had one client at a CCRC who was in assisted living, and she wanted to stay in assisted living. Cognitively, she was fine, but physically, she could no longer walk to the dining room. That was a criteria. If you can't walk to the dining room, you can't stay there. And so she was frustrated. I was frustrated, but ultimately, she chose to move out of the community so she could have a little bit more autonomy. She did not want to live in a healthcare center. But that's not to say that a CCRC is the wrong choice. You just have to kind of look at the whole picture and know some of the right questions to ask. They're asking questions like, okay, so if we get to the point where we have assisted living, if I need 2 people to help me get up, can I stay in assisted living? Or if I just can't walk to the dining room, I need 1 person assisting while I walk to the dining room. Well, I have to move to the healthcare center. If I need an insulin injection, so really knowing each care model for each community, and that would also go for an assisted living community. So there's a lot of freestanding assisted living communities. Unlike the CCRCs, the assisted living communities do not have a healthcare center within their building. They just have assisted living. Assisted living is considered non-medical, but there are some communities that do have a nurse on duty. But also there are some that will really do a very wide-reaching range of healthcare services, but they're more or less considered custodial: bathing, dressing, grooming, transferring, escorting, one-on-one, walking to and from activities in the dining room, repositioning, two-person lifts, even a Hoyer lift. So there are some places that do a high level of care, but they stop at a Hoyer lift. And, Mr. Jones has been there for 4 years. He wants to stay, but now, he's a big guy and two people aren't really safe doing the transfer. So now Mr. Jones has to move. So those are also topics that when I go meet with a family, depends on who I'm meeting with, I start asking, reminding them of certain questions. So then when we do take a tour of a place to consider, we're asking the right questions, or lots of times I already know the answer. So I say, I know you really want to go to place A because it's right in your town and everybody, all your friends have been there. But I think in your situation, you're going to need more help within the next 6 months to a year, and you're not going to fit into their care model. So moving twice is not a good idea. So then I kind of steer them a different direction so all their needs can be met and they don't have to move a second time.
Yes, it's hard enough to move.
It is. So I think I was saying this to you earlier.
Yes.
Planning ahead is a great idea, but it doesn't always. The best laid plans. You can pick out the place you'd like to go when you have care needs, but by the time you actually need, if you ever actually have those care needs, it might not be the right place anymore because there might be another factor involved.
Right. And it's the same conversations we have as advisors, is you need to start planning and planning early. How are you going to cover some of those costs that are not covered by a Medicare, Medicaid? What does that look like if you decide you're going to go to this facility and find out that you can no longer do that and it's going to cost twice as much? And having those conversations sooner rather than later is really beneficial, but we feel that we're never going to age, we're going to be just fine, everything's going to be taken care of. So I can't stress enough how important it is to have those conversations and make those plans and get something in place. The other interesting thing, Carrie, that when we were talking, you mentioned, and I didn't think about this because my sister and I have toured facilities on behalf of our parents, unbeknownst to them. And you mentioned that we should not leave our information with them. So can you talk a little bit more about that?
So leaving your information at a specific community is okay. Where I really caution people is if you go online and they say, well, what is your loved one's name? And you type in their name, they grab onto that name and they send that name out to lots of places. And then you might start getting phone calls. It can be very scary, annoying, just overwhelming to have. Because with the internet, people can get your information like that. So even if you don't leave a phone number, they have your phone number once you give them a name. So I would really caution people when you're doing any research online, do not give them any information on yourself or others. I think that you think you're calling. This happens a lot when I talk to somebody. They'll say like, "Oh, I thought I was calling such and such community." Then all of a sudden, I started getting all these phone calls, like immediately within minutes, and I'm like, "Oh, you must have been on another link or website." And sometimes those services can be helpful if you're out of state and you don't even know where to begin. But I would really caution you to be careful not to give the information out. But if you are in a community and they want to follow up with you, then I think that part's okay. But if you just give it to somebody over the phone or and you type it in online, be very careful as to who you're actually giving the information to.
And do those calls, so I know, Julie, we talked, I'm sure our information's out there. So what can I expect when I turn 65 as far as phone calls and information that I'm receiving, and what can I trust?
Right. Anyone who is 64 and a half knows what happens because your name is on a list. It's very easy to purchase a list where somebody's, let's say I want to find everyone who's turning 65 in the next 3 months in this zip code. And that's why you start getting the information. Now you have information coming from carriers and agents, and we are not allowed to call you. So if you get phone calls, it's rather interesting how many phone calls you do get because they're not allowed. In fact, I have a permission to call card over here because, if you want me to call you, I have to first have permission to call you. So it's very interesting how many phone calls actually do go out. But what I say to clients is, if number one, if you're working with an agent, throw all the marketing away. Just get rid of it. It's overwhelming. The things that you want to make sure you do not ever throw away are things from the Department of Health and Human Services, Centers for Medicare and Medicaid, which is CMS, or Social Security. Other than that, you're good. You don't need all that other stuff, at least if you're working with somebody. If you're not working with somebody, chances are you're going to end up calling a carrier and they're just going to talk you into their plan anyway. So I deal with that a lot, where people are just overwhelmed with so many phone calls and so much information. So,
Yes. And I know the other topic that came up around Medicare was, I had always assumed once you sign up for your Medicare and you've got Plan A and B and supplements all in place, it's done. But I understand that's not necessarily the case, that we can go back and review it. And should we? What are our choices there?
Very good, absolutely. We have enrollment periods, which when you're turning 65, it's your initial enrollment. We have special enrollments, which is when you're coming off your employer plan, let's say, or moving to a new county or moving to a new state. And we also have what we call annual enrollment, which I'm sure many of you know about. It's October 15th through December 7th. And that's the time that you want to talk to your agent about, if you're not happy with the plan that you're on, or you want to review your drugs. Let's say it's not working out so well and your co-payments are too high. Another thing is just you get, what is it called? An ANOC, an annual notice of change. So if you're on a drug plan or a Medicare Advantage plan, you're going to receive what we call an ANOC letter, annual notice of change. And it should already be in your mailboxes. You might already have received it. And what it does is it tells you, here's what you currently have, and here's how that plan is changing for the upcoming year. That's when you're keyed into, okay, maybe I need to call my agent because I don't like what I'm seeing here. And we have that going on right now. I will not say names, but there's a carrier, and it happens every year. Your drug plan may be $15, and instead of getting rid of that plan, they say, oh, now your plan's going to be $68. Okay, so we're going to have lots of phone calls over that, because if you're paying $15, you don't want to pay $68 next year. So that's how you find out. But a lot of customers just know that October 15th through December 7th is that time frame, and they will just call and get on my calendar right away now, knowing that we can start talking about the new changes October 1st.
So if I don't make it before then, with December 17th, you said, then I have 7th. Then we have to wait until the next open enrollment period to make any changes.
Absolutely correct. So if you don't have some kind of special enrollment period that allows you to change, then yes, you are on that plan for. Yeah.
Okay.
There's, I don't want to confuse anybody because there is a product called a Medicare supplement plan that does not follow these rules, okay? But the drugs and the Medicare Advantage do, so that's why it seems like the supplement plans follow the same rules, because you have to have a drug plan to go with it. So you're kind of in that. I just don't want anybody to walk away thinking, oh, she didn't say that right, because you can change your supplement at any time.
Supplement upon supplement upon supplement.
Exactly.
Perfect. Well, thank you both for being here today.
Absolutely.
And thank you, everyone. I know there are questions that you probably have for Carrie and for Julie. I just want you to know, again, that we are mindful here at Potentia that money touches every aspect of your life. and we are seeing healthcare costs increasing. So if there's anything that we can do to help as far as planning for that, using Julie as a resource and Carrie as a resource, please, ask the questions, let us know. We are here for you as a team.